machine here is actually, it's our newest linear accelerator. We have two that have been purchased since 2012. And there's several unique things about this machine. So a linear accelerator is a modern device for delivering radiation therapy for cancer treatments. And some of the things that are neat about this is we can do something called image-guided radiation. So the kinds of cancers we treat on this, of course, we treat breast cancer, but we also treat lung, prostate, cancers within the abdomen. Right before we start to deliver the treatment, turn the radiation on, in the control room right outside, we can image the part of the body that we're treating, so we can be sure that we're treating very accurately and precisely. For some tumors, we can actually see the tumor where they are located at the time that we're delivering the treatment. So this really improves our accuracy in our patient care. And it's not just that we're accuracy in treating what we want, we're also accurately in not touching the parts of the body with radiation that we don't want to treat. So we have image guidance, that's image-guided radiation. This machine rotates about on its axis, so it can treat really from any angle. There's also something within this part of the machine we call multi-leaf collimators, and they're little dense fingers of metal that change position during the treatment. So as this machine is delivering the radiation, it's shaping the radiation. So it's very much shaped around the part of the body that we want to treat.
So this is our new 3D automated ultrasound unit made by Siemens. It's a procedure that we do on patients after they have their yearly screening mammograms. We do it because there's an advantage for women that are very dense and fibrocystic. It actually takes three-dimensional images of the breast that's more detailed than a mammogram. It's used for women that are only dense, not women that are fatty replaced. But basically, to do the procedure, we position the patient on the table. We bring this automated unit across the patient, and it's positioned across the breast. And we basically take 3 images of each breast, depending on the size, to show us the breast tissue itself. And then after the procedure is done, the radiologist reads it, and it actually takes 318 images per slice. And we do at least 3 slices on every single patient on each side. So there's usually about 2,000 to 3,000 images that we take. It gives the patient's advantage to having this done is because we can see behind the tissue better. On a mammogram, it's 2-dimensional, so it hides very small lesions. This is an advantage because it takes 3-dimensional images, somewhat like an MRI. And the patient is typically read within a week after the patient is done to give her time to look at everything. And we find very small lesions that can be treated quicker than bigger lesions.